Yeah.
All right, well, we're talking about foot and ankle health today on Ask the Expert. Dr. Corey Russell's here to take your questions. You can reach him by dialing this number, 419-534-5430. Your foot and ankle health is our topic today on Ask the Expert. Dr. Corey Russell joins us with the answers to your questions. Good morning.
Good morning, Tony.
All right, well, the first one sounds a little painful. Someone has a bruise under his toenail. How long will that take to go away?
Yeah, actually, we hear that quite commonly in the office. People come in, they'll have a bluish black spot underneath their toenail. They're not sure how it got there. It seems to be not going away. Well, it does take a while for a bruise underneath the toenail to go away. It takes at least 6 to 9 months minimum because you have to grow out a completely new toenail. So it will take a while, but eventually will grow out.
Ouch. Okay, well, Tina just said that she had one on her toenail too, so it's going to take about 9 months. Frisbee injury, how about that? Well, what do you recommend for treating corns and calluses?
Corns and calluses, obviously a lot of people have this kind of problem. So what can you do with it? Well, typically we recommend moisturizing cream to the area. I'll recommend patients get a pumice stone. That's over the counter. They can get it at the pharmacy. It's mildly abrasive. You can take some of that dead skin off. What I don't recommend is to soak your feet. Soaking can actually dry them out and actually make these corns and calluses worse. Obviously, you have to look at your shoe wear as well. Make sure nothing's rubbing on the toes, leading to a corn. There's corn pads you can use or any type of non-medicated padding, which can help the corns as well. But stay away from the medicated corn pads as they can lead to other problems like wounds.
Gotcha. All right, well, this next question you may get from people who work in retail, especially if they're on their feet all day long, their legs can swell up. Someone may have that.
Sure, and that happens frequently for people. Typically what we do, or what I recommend for patients that come in with this kind of problem, is to elevate the legs as much as they can to help get the swelling down. Preferably, if they can elevate their legs above the level of their heart, that seems to help. I'll recommend compression stockings, which we'll do in the office. We'll take measurements around the ankle, around the calf, and actually make them special for those patients. Usually they go up to just below the knee, although they can be made to go a little bit higher. And there's various different tensions we use too, depending on the severity. Lastly, I'll recommend that they lower their salt intake, which will also help to lower their lower extremity swelling. And obviously they can talk to their primary care physician as well to see if there's any underlying problems that will lead to the swelling in their legs.
Okay, and that actually kind of brings us to this next question, because I've heard that gout can cause an affliction in your feet, and then it also is related to what you eat. My dad said it used to be called the rich man's disease because it was associated with steak, so I don't know if that's still true.
Well, yeah, it is true to a degree. Cream sauces, the heavy, rich cream sauces, the fatty sauces tend to lead to attacks. Typically, we recommend for these patients to stay away from fried foods, stay away from sweets, stay away from anything in a heavy cream or gravy type sauce. We also recommend they stay away from certain types of fish like mackerel, anchovies, sardines, and as well as scallops, which can also lead to an attack. Avocados should be eaten in moderation, and also, unfortunately, alcohol, sometimes you have to really limit your intake because that can precipitate an attack as well.
All right, one last question here. Someone called and said they have an open sore on that person's foot and he or she is a diabetic, so what should that person do?
Diabetics are prone to getting sores on their feet, and we always recommend to our diabetic patients, check your feet daily, check in between the toes, check the bottoms of the feet. So if you ever see any type of open sore, anything's bleeding or anything, certainly wash it, keep it clean, wash it with an antibacterial soap and water, maybe a little bit of antibiotic ointment on there. Certainly need to contact a podiatrist or a local wound care center. I always tout Mercy at St. Vincent and St. Charles have great wound care centers. I myself work at the St. Vincent one and St. Charles occasionally as well. Certainly they can take a look and carry that treatment further.
All right, we can Google Dr. Russell. Thank you very much. Appreciate it.
Thank you.
All right, next week on Ask the Expert.